Okay, we are live, gentlemen. Hello, everyone. Hello, our viewers. Hello, our listeners. Welcome to another episode of Inspiring Time with Juliet. This is your host, Juliet Hammond. I welcome both our new audience and all our faithful audience. I welcome you all. Today, we're going to dive in immediately into a very crucial discussion, something that I find very important myself. Being in healthcare, I just find this very interesting and very inspiring as well. So I'm looking forward to this very discussion. It's going to be quite interesting, very edifying, and educative as well. I know that healthcare in general is under transformation, and they have transformed over time. And most of the care that we're providing is actually going, is heading towards bio-natural medicine, or what we call complementary medicine as well. So today I have a team here, wonderful gentlemen that I'm going to start introducing one after the other. First of all, I'm going to introduce Dr. Sonny Ahonsi. He is the founder and CEO.
Hi, Dr.
John
Juliet. Yeah,
McKay.
Dr. Juliet, I'm glad you're having me here on this platform today to tell the world about the transformation in health and well-being. And yeah, we look forward to having you being our host, our hostess for this afternoon on behalf of School of BioNatural Medicine with Mount Moriah radio station. Back to you.
Wonderful, wonderful. I'm so happy to hear that. I have another guest here, part of the team, John McKay. He is the managing director of BioNatural Medicine. John, could you please say hello to people?
Hello, everybody. I'm here in England. Can you hear me, by the way?
I
Yeah, we
can hear
can.
you.
Can you hear? Okay.
Yes.
Yeah. It's a
When
bit faint,
Sonny,
but we can hear you.
when Sonny told me about this idea he had very, very long ago, I jumped at the chance to get involved. There are so many things we do in life that don't really satisfy us on a deep level. But the thing that really does satisfy us on a deep level is being human and giving everybody else as much as we can to get the best out of their humanity. And that, of course, means health. So that's my two pence for the moment.
So today, great. You're welcome to Mount Moriah Radio and TV, Inspiring Time with Juliet. I also have another guest. His name is Artwood Andrea. He is the board of directors operations for BioNatural Medicine. Could you please introduce yourself?
Hi, Juliet. It's nice to be here today with our CEO, Dr. Sonny, our managing director, John McKay, and myself being on your TV show. This is an amazing time because, like we always say, health and wellness is the business of every single person living on earth. It's no longer to be left to just the professionals. It is your responsibility, just as you care for your car, even before you take it for inspection or to the mechanic or to any other form of service that the car requires. You are the first person who cares for it. But the health that you have, it is time for everybody to be responsible for caring for their own health. And that is knowing exactly what happens in your body and knowing exactly what you need to do to optimize that. So it's an amazing time, and I know it's going to be an awesome show today.
Wonderful. That's great. I know that the audience and listeners, they will want to know a little bit about you.
Sound?
She's breaking up a little bit, but
Dr. Sonny, can
Sound?
you hear me?
I
yes.
can hear you very clearly. Dr. Juliet.
All right. Okay. I'm saying, could you please tell people a bit about yourself? Um, why are you part of the BioNatural medicine team? What is your journey so far?
Okay, let me start with the journey of School of BioNatural Medicine. In 2011, in London, I took my son to a hospital in London, and we were waiting for a doctor to look to see exactly what is wrong with him for over 10 hours. So based on this, I decided to take it on as a project to see the possibility of creating a platform, a software, a technology that can connect a patient to doctors remotely. Then back then, around about 10 years ago, when I spoke to John, John said, "Oh, this is a very, very brilliant idea." And you just have that aha moment when somebody said to you, "This is a great idea." John and I traveled to so many different countries, in different parts. We went to America and we went to other countries. We went to
All
part
over
of
it.
Africa and we went to part of India with other colleagues. And we went to part of the Middle East to see Artwood and the team to see exactly what we intend to do. And some of the people that we actually met, they thought it was nonsense. And others thought, yes, it's a great idea. So this is how we embarked. My background, I mean, I'm a chartered accountant by qualification. About 30, 40 years ago, I qualified as a chartered accountant, but I have worked in the healthcare industry for the last 22 years as an assessor in health and social care. And I developed a program for universities whereby the healthcare program was accredited, and I was one of the teachers and an assessor on that particular program. So coming up with a digital infusion of computer and healthcare was something that was natural thing for me, but I need to do more research in terms of what we need to do, how we're going to optimize and bring about a technology whereby you are based in one particular location and the patient is based in other location, then you're able to connect. Not only able to connect, but you're able to assess the patient condition remotely using technology. Because these days, as I always say, technology enables proximity. So if we've applied technology in many fields, in education, in travels, in other aspects of life, why can we not apply exactly the same technology in terms of healthcare? So today, Dr. Juliet, you'll be very happy to know that we have got a technology called BIPI, standing for BioNatural Indicative, Preventative, and Innovative Technology, that we're able to scan, assess a patient condition to create indication of the patient's body, whether pathologically or it is physiological. The technology is able to assess all of that within the patient and able to inform the healthcare professional indication of where the patient needed a lot of optimization, a lot of support, a lot of help. So once that indication is revealed, you can send that indication to a practitioner, a medical practitioner, who will be able to have a second look and see exactly how they can help the patient. All of that can all be done remotely without the need to go to a certain geographical location.
Mm-hmm.
Mm.
That sounds so interesting. I'm so excited about this journey. So how did you come into it? How did you get interested with this BioNatural medicine, Andrea Artwood?
Yeah, Dr. Sony, came to the Middle East to meet me in Dubai many, many years ago, about 6 years ago, thereabout. And he told me about this idea because of his experience, his personal experience. And I gave it a thought as at that time. And I thought it was a great idea because when I look at the evolution of the telephone, for example, the telephone has gone through so many phases, right? Long before, you have to go to the telephone house to make a phone call. And
Yeah.
your relative that is very, very distant away have to know exactly what time you are going to be calling in so that they too can be at the telephone house. Eventually, we had, the telephone booths. And then it evolved. They could place telephones in your house, your offices, but you couldn't move them around. And eventually they made one you could move around. It was too big. They started creating, making them smaller, developing, innovating, changing, and that has brought to birth what we have today, the telephone that is mobile and you can just take everywhere. So why not healthcare? Why does somebody have to be at the hospital to receive the attention of a medical personnel? Or why do you actually have to wait till you are sick to break down to actually start to find solutions to your problem? So it was a brilliant idea at that time to have a technology that helps you to understand your body, know the process your body is going through, whether it is, physically, emotionally, or otherwise. And then the program can also help you to see exactly what you need to do, whether you need to make lifestyle changes or you need to actually seek the help of a medical practitioner or just some changes that will actually bring your body back to optimal health. I thought that was a brilliant idea. And over the past half decade, we've been working on this particular project to see how we can give every single person on the planet a hospital in their own home and access to medical care through the use of their mobile phone, just as everybody has a mobile phone today. That has been the idea, and that has been the development, and that was the motivation that we had.
My goodness, gentlemen, I'm just listening to you, and I'm so fascinated about how this journey actually started for you, from Dr. Sunny taking his son to the hospital and staying there for about 10 to 12 hours, and then coming out and thinking, how do we change the system? It's actually changing the system that he was thinking about. Dr. Sunny, I know it all started with you. Do you think that you have achieved the purpose from coming out of that hospital that very day? And now, today, do you think that that mission, that purpose has been achieved today?
Well, Dr. Juliet, it's quite interesting what what you just raised. A tree cannot make a forest. No, a lone voice can cover the whole of the sound in a whole city. Hence, the need to galvanize and bring together a team of people. Andre, John, um, Grant, and many. Right now, John and I started almost about 10 years ago. Then about 6, 7 years ago, we have people of Artwood who are part of the whole, at the center stage of the whole system. Today, we have a team of people, over 40, who are directly working on this project. Medical doctors, IT professional, and our marketing team, our global team who are working in many, many countries, in America, Canada, Europe, England. Of course, this is our home-based country. We have our other people who are ambassadors who are working with us in over 40 different countries to make sure that health and wellness is accessible to every single person on the planet. According to the current statistics, we have over 8 billion people on the planet. And these 8 billion people have a need to have healthcare. So on the base of these 8 billion people, we want to be able to reach every single person with their primary healthcare with the aid of our technology, our BIPI, BioNatural, indicative, preventative, and innovative technology. We're using our network of doctors and practitioners and nurses and pharmacists to be able to reach the most distant part of the globe, regardless of the location of the doctors and the patient. Just to demonstrate that, for example,
Yes.
you and I are in different locations. Artwood is based in the United States. Grant is based in London. I am based in the other part of London. And John is based in other parts of the UK. But we are currently in the same room at this point in time. So you are able to hear and understand what I'm saying. It's the same way with the technology. With your inner voice, you're able to, the technology is able to record and carry out a scan of your whole body using a 3D imaging system. And on the basis of that, able to get into the organ, the pathogen, and the possible root cause of that. And it's able to send that report to your medical doctor, who is able to reanalyze that and able to find solution for the patient within a very, very short time. So that's the objective. The objective is to be able to bring healthcare affordably and within the reach of many, many people, particularly at-risk population, which is more than 4 billion people, according to World Health Organization, globally. So we need to be able to reach all these people with few doctors, with few pharmacists, with few nurses, but with the optimization of information technology, IT, we're able to reach so many people at the same time. Back to you, Dr. Juliet.
Okay. I can see that Grant is here. Grant, you're welcome to the show. Hello? Can you hear me at all? You can just unmute yourself. That's great. Yes.
Thank you so much. Thank you. It's great to
You're
be
welcome. Yeah, nice to meet you too. Listen, I've been listening to Dr. Sunny, and I've had Andrea Artwood talk about this BioNatural medicine, how they want to make it accessible to many people across the world. My question is, how that are, they haven't got technology with them. How do you reach those people too?
Wonderful. You cut out for a moment, but I think he was asking, how do you reach people who don't have technology? Well, one of the greatest things.
Yes.
Yeah, what we will actually find now, Juliet, is that in places where an individual doesn't have technology, quite often there's a hub. There's a hub in a center of that town, etc., where there will be shared technology. Think in the times in the UK, going back before we had personal computers, quite often there would be a computer or several computers at a local library. If you think of it in terms like that, this will often be, in the worst case scenarios, there will be shared hubs within either the town or somewhere not too far away. As time progresses, that is going to increase further. And quite often the case that even if that individual hasn't got that technology, a friend, a neighbor, an associate nearby does.
That's a wonderful answer. So they can share with friends, they can go to hubs, they can use the library. There are places they can go to. some people have cafes as well. They have what they call computer cafes where they can go to and access this information. Brilliant. Do we still
Correct.
have John McKay with us? John, are you still with us? John, are you still with us? Because I can't see him.
I don't think John is at the moment. I think he's having some.
So I think he's
technical
having issues. He's having issues. Okay, so my question again will go to Andre Artwood. What is the vision of BioNatural medicine? What is your vision?
Just as I've explained a little bit earlier, health and wellness is everybody's business. But people don't know this because they think that
That's right.
health and wellness should be left to the professionals. They think that you have to wait till you get sick to get medical attention. They think that once you get to a hospital, then all your problem, is now being shared, and then the doctors and all the other people who can offer services, are the ones that are responsible to care for you. But this is not the case. This is not the case at all. So the vision is first of all, for everybody to know where they are when it comes to their health and wellness. Know your body, right? Because if you do not know your body, you will not know if something is going on or if something is going wrong with a particular part of your body. So when you know your body, you know every part of your body, the functions of your body, what your body needs to function effectively, right? What lifestyle habits are necessary to facilitate those functions. When you have the idea of everything that has to do with your body, then you understand your body, and then you can know how well you can manage your body. And the vision too is to help everyone around the globe to understand what lifestyle medicine is, what preventative medicine is. You don't have to wait to get so sick, to break down totally, to go to a hospital. I always refer to cars because people understand cars. Whether you have a car or you don't, people seem to understand that sometimes you find that a car will break down along the road and you have to call a tow truck. So before your body gets to that point where it breaks down and you have to be towed to the hospital by an ambulance, if you know your body and you know what is going on in your body will not get to that point where it breaks down. You will always know exactly what to do to bring yourself to optimal health. And that is the whole idea. Instead of waiting for everyone to get sick, why not adopt a system of medicine that helps you to understand your body, bring you always to optimal health, and help you in the best sustainable way to practice your healthcare? That is the vision, and that is exactly what we are trying to educate everyone on, help them to see, help them to learn, help them to understand how their body functions.
Okay. I've got some comments here. Some people are, this person is joining from Nigeria. The other person is joining from Kenya. And someone else is joining from United Kingdom. And they are sending their greetings. They're sending their greetings, gentlemen. Okay, so Dr. Sunny, you mentioned something called BIPI scan. What is the protocol of this scan? Who is it designed for?
Okay. Now, I think it's important to take all the listening, Dr. Juliet, back to my story 13 years ago, 2011. When I took my son, who was 5 years old, in London to a hospital in the middle of the night. I was waiting with my son and severely suffering from excruciating pain in my arms. And this is me, rather than blaming the doctors or the NHS, the National Health Service in England, which is a fantastic institution, and the doctor worked very, very hard to look after all of us. But they needed something. The doctors needed some support. Our hardworking doctor, not just in England, but globally. Our pharmacists who are looking after us in terms of medical dispensation, they're all working hard. The research that goes into it and everything else, all of these are all great strides in order to look after humans' health. But that system is over 100 years old, and it needed the right tools, and this is where technology actually brings it back. So my idea was to create a system that brings the doctors and the patient closer together using technology. You and I are able to communicate, but with different geography, different demographics. Some people from Kenya, as you mentioned, South Africa, from England, from Belgium, from America, from Moscow, they are listening into this particular conversation that we're having right now. So in reality, we are in the same room, we're in the same clinic. So the doctor here can look after those patients remotely using technology. So this is what I call the infusion of medicine and technology. Technology enables proximity. So it's able to bring together, closer together to the doorstep of our medical team. And with this technology, everybody on the planet of over 8 billion people can at least have access to a medical attention so that the doctor can look after the primary care. Just to give you an example, the illustration here is this. In England right now, a medically advanced nation, we have about 20 million people waiting for primary consultation with a doctor. Some people are waiting for more than 24 hours just to see a doctor. It's not because the doctors are lazy. It's not because the pharmacists are lazy or the nurses. It's just because the system is overworked. It's overwhelmed.
Yeah, it takes a long time to see these. Yes,
absolutely. And we also live in an environment whereby a lot of doctors are leaving the profession, either through voluntary retirement or compulsory retirement, or they change their profession all the way completely.
Yeah.
And the demographic also is that our aging doctors are leaving the system. So on the base of this, if we leave the system in the hands of manual operation or medical intervention, the current problem we have we will be on it for more than 150 years, and we're not able to get to the solution of what it is. But when we start applying technology, the proximity that the doctor has with the patient, technology will now help the doctor to be able to cover so many patients, at least at the primary care stage level. So we need our doctors who can intervene, humanly speaking. Then we need a technology who is able to expand the whole operation within reach at the same time. So the whole idea is to facilitate the whole medical intervention and the caring for the patient so that the patient's experience is transformed and is fastened, quickened, communicated, and the doctors, rather than looking for a particular prolonged problem or what is happening with the patient, technology can define and optimize and identify the organ, the pathogen, and the possible root cause of that, and the doctor can have a speedy action in terms of dealing with the patient. So that was the idea back 13 years ago with my son, and now with a team of people like Grant, Artwood, John, and my other team around the world, and with all the medical practitioners we have, we are getting solution to what is actually wrong with many, many people around the globe, not just in England, but every part of the globe, patient can have access to medical dispensation. Today, whatever country you're in, you can just ring a bell and the doctor will be at your clinic, at your home, with the aid of your mobile phone. Doctor in your pocket and hospital in your home. Isn't that amazing?
That's amazing. That is actually fantastic. Jana, I know you're having troubles with your system. You're going in and out. Are you okay now? Can you hear us?
It's all right. I'm there. I've, I've stolen my wife's laptop.
Okay.
So, can you
Stolen.
hear me? I've stolen my wife's laptop, so it's fine.
Okay. I think you might answer this question because this is my next question. You have this global ambassador program that you're doing. What is it all about? Who benefits from that?
Yeah. Well, look at the world's finances, the way they're going. Everything's going in a mess. Prices are going through the roof. I've got friends in America who are actually really suffering, and that's what the richest country in the world. The Chinese economy has gone down the toilet. There are strange things happening. The world is changing. And people get very anxious. And when they're anxious, they get ill. Anxiety is the biggest killer on this planet. Always has been, always will be. Because it's a fear that you won't be able to survive. And when you're sick, anxiety exacerbates that sickness. It makes it worse. And the problem is, in a country with or in a world with failing economies, how do people make the money to pay for medication? Because that's it, doctors have to eat as well, hospitals have to be run, businesses have to do stuff. Well, in many countries, as industry fails, there's always one thing that people will need. Well, two things actually: income and security, health security.
Yes.
The GAMP program, the ambassador program gives people an opportunity to protect themselves, to protect their families, and if any little money that comes into your family stimulates the economy, your private economy, your domestic economy, it means you can afford more choices. Which schools your kids go to, or when you're going to buy new shoes or whatever. But the way things are going, Africa's going to suffer, because Africa, all too often, throughout history, has been at the end of the line. So and it's not just Africa, it's other countries are going to suffer. But here is something where people can work. They are working for themselves in that they make the decisions about how much they operate their business. You're not working for somebody who might chuck it all in next week and go live in California. And we've seen that all too often. This is where people can work together, families can work together, communities can work together. And you stimulate your local economy by bringing in money. It's only a little, but a little multiplied by a million is quite a lot, and we can do that. So we can give the money to pharmaceutical companies to poison us, and they do, because every medicine has a side effect. Every single chemical has a side effect, and it's insane the amount of medication people are on, especially here in Britain, because we have a National Health Service where as a citizen, you're entitled to medicine. And people are rattling as they walk along. They've got so many pills inside them. And all of these are having side effects.
Some people have got a cupboard full of medicine. Yeah.
Yeah. So now we need to think of alternative ways. I'm an engineer. I'm not a doctor. I'm an engineer. We have all this new technology, and it can be applied to every part of life, including healthcare. Um, Looking at the future of healthcare, educational standards are dropping. Nobody's identifying as a nurse or a doctor. The ridiculous pseudo-politics that are running the world right now are not going to do anybody any good. So this is why we do it, because we have to give people a chance. If they don't take the chance, it's a free country. But
That's
at least
it.
the chance
And
is there.
it benefits everybody. It's not restricted to geography where the person lives. Is for everyone, and the program is meant
It's
for
human.
everyone. They can access it through technology. I'm just wondering, how. I'm just going to give you an example now. Let's take, for example, you have someone that is interested in joining the program, and they have done their scan. So what happens after that? After they've done the scan, what happens after that? Grant, do you want to enlighten us? What happens? They've joined the program, they are very much interested, and they have done the scan. So what happens from there?
Fantastic. So we've done the scan.
Well, it's like taking you. So sorry.
Go ahead, John. Go ahead, John.
No, I'm just going to say, if you take your car to the garage to get fixed, you don't expect them.
Yes.
You hand it over to the driver.
Yes.
You're giving information to the doctor. If you think of this as tomorrow's stethoscope, yep, but it doesn't just measure what's happening here and there. It's a full body analysis like that of all the relationships between every cell in your body, and anything that's impinging one of them is going to have a vibrationary effect on its little friends next door. And eventually that's how a disease spreads throughout the body. You hit it. This is preventative medicine. Remember, it's bioindicative. It's preventive medicine. You have to, it's no use waiting until somebody's on a stretcher before you treat them. If you've got a way of plugging them in for 10 minutes to a telephone, or not even 10 minutes, 10 seconds to a telephone, and they can get a full body report and take it to a doctor, or refer it to a doctor through our systems, finding an affordable doctor. It might be somebody who speaks the same language as you. There's no point in somebody like me trying to talk to somebody in Russia, because I don't,
that takes me to the next
system.
That takes me to the next question. So if someone in Africa, for instance, joins the program and they're very much interested, so how do you not connect them to someone in that same country, or someone from the United Kingdom or United States can attend to them? How does it work? I'm trying to get this out.
Yeah. So, like we mentioned earlier when we started, the world has about 8 billion people in it right now. And every single person, regardless of your geography, needs health care. And that is why this system we are developing is not restricted to a particular demographics or geography. It is international. We have members and doctors in India, in Asia, in Africa, in the UK, in the United States. We are going to have soon in Australia. We have some practitioners in China, in Singapore. We are trying to have a core where every individual on the planet is not restricted to receive health care or are not getting the health care they need just because they're in a particular geography. And this is really, really wonderful, because when you tell people about this, when you listen to their response and the way that they have thought about it to see the practicality of how this works out. It's really, really amazing to see how people are volunteering and joining the program. We have so many doctors from Nigeria, from Ghana. We have doctors from the United States here, in Harley Street, there in London, in England, and some in Manchester. A whole lot of people in Singapore, both doctors, health practitioners, and support staff who are willing and are able to see how they can impact the medical situation of people globally. So if we have somebody, for example, who is in Ghana, that person doesn't really necessarily have to wait for a doctor in Ghana to receive medical attention. Our doctor here in the United States can look over that result and immediately give an insight of what needs to be done next. Remember, when it comes to health and wellness, there are different types of conditions that require different types of strategies. And if this condition is not something that, has to be like an urgent care, this person can be placed in a program, whether it's a lifestyle program, whether it's a health and wellness program, whether it's a preventative program, to reinstate the person to optimal health. And in some cases where somebody, like if you have a fracture or somebody needs, to go through an operation for an appendix, obviously we can't do that over the phone. So we'll direct the person to our closest affiliate hospital, because we have hospitals in the system signing up as well. So we direct these individuals to our affiliate doctors, affiliate hospital, and they receive healthcare at the lowest and most affordable cost, just because they are within the program. So this is what we are doing right now to make sure that we bring an equalizing around the globe.
Yeah.
I've got a gentleman
the way
here.
frequency medicine is going, I wouldn't be surprised.
Yeah.
Oh, sorry.
Yes.
I was just thinking the way frequency medicine is going, I wouldn't be surprised if you could fix the appendix over the phone.
It's so true.
I'm sorry, Juliet.
It's so true. Honestly, the way it's going, I actually watched a film where that happened. So I was thinking, this is now in a film. I think it's going to happen. It's actually going to happen quite soon, sooner than we think. So I have a gentleman that says here, says, how do we join the program? He's asking, I think he's from Brazil. He said, how do we join the program? How do people join the program? Yeah. Grant, you can answer that.
Okay, yeah, sure. I'll jump in this time. School, if they go to School of BioNatural Medicine.co.uk, they can go there. And in fact, maybe later on you can we can
I can just add it here. I will. School of
Absolutely.
Natural.
And they can go there, all the details. It's super simple and quick to register. And that's when you can get everything you need to know about the program, how to go forward with it, etc. And it's been especially designed to make it super easy for people. So it's School of BioNaturalMedicine.co.uk, and we will even follow up after the show with a link, which I think you have already.
I will do. And the next question is coming from a lady. She says, do you pay? She's saying, how much and how do you pay for it?
You can pay for it online. And it's currently £250 per year. Is that right, Sonny, at the moment?
Yeah, at about 250, 249.99. Yeah.
249.99. I know it's 250 virtually. I just want to be absolutely exact on that to give you the right answer. And that's everything included there. And again, as you were saying, it's about giving people choice. It's all about giving people choice on their outcomes these days. John was saying how it's preventative medicine, and it absolutely is. It's preventative in many cases. It can help to find early signs of things, early trends, so that you can actually take action to alleviate that, manage that, and so on and so forth. It's all about choice in people's health, well-being, and of course in people's wealth too. So all of these things, it's all part of the overall, what we call overall wealth scheme. wealth in many different aspects of your life. And I think this is the way, as Artwood was saying, it's crazy. In other aspects of life, people have choice. Why should they not have choice in this? Whether they do or don't, that's fine as long as they have choice, and that's what we're here to do.
Absolutely.
That's brilliant. Honestly, I can see Janet. Janet, thank you for joining us.
Yeah.
You joined us a little bit late, but it's nice to see your face here. It's been wonderful speaking to the gentleman. What is your role? If you can just, summarize what your role is within the School of BioNatural Medicine. If you just summarize what your role entails in just 30 seconds, starting with Artwood. What your
Yes,
role is.
as has been mentioned earlier to you, we, the board of directors, myself, and a good member of the team, we are responsible for the daily operation, day-to-day operation of the School of BioNatural Medicine. And this is really, really amazing because with a great team, you can really, really do a whole lot of good, and you can do a whole lot of good work. And I'm telling you, this is an amazing team. I don't know how Dr. Sonny picks his team, but right now we have an amazing, solid team that every single one, every single person on that team has the same mindset, providing health and wellness at the best.
I can just vouch for you, because when I told Dr. Sonny, I said, "Could you please come to my show?" He said, "Oh, I've got a team." He's so proud of his team. He's so proud of his team. So yes, I can just see that happening. Tell us a little bit of what you do for the team, Grant, please.
Oh, thank you. Yeah, I'm one of the board directors as well. I've been with Sunny for about 7 years now, about 7 years ago, and we've been involved with this from pretty much day one, once when we met. And I'm part of the strategic operations team. So we really take a look, as Arthur was saying, at the overall operations, the strategy, the delivery. Because as you can imagine, Juliet, we've got a range of various projects going at any one time. So it takes a range of different disciplines to do that. So when we look at the strategic delivery, that's where I come in.
Wonderful. And John, what do you do? Because I think I've seen you in one of the programs, one of the conferences before. What is your own role within the
Well,
team?
other than being mainly decorative, I, I, I have. I was trying to tell you, I have an eye for detail. My background isn't just engineering. I did 20 something years of that, trying not to fall off oil rigs and that sort of thing. But also then I went back and studied philosophical aesthetics for leadership, and it's the analysis of language, basically, and the way people communicate to each other, and then how you can gauge your communications with them, which I just messed up. Yes, that,
I think the line is breaking up there, but I think what you're trying to say is that you are an engineer, but you went and trained to be someone that interprets languages, right? In a nutshell.
well, I did it. I've had a bit of a mixed thing. I went off to say my family was poor, so I had to do something, to eat. It's a nasty habit we all have. And then I did that for years and packed it in, and worked in theatre for years after that. And then I was just retired for 10 days, and Sonny said to me, "Would you fancy a week in Dubai?" I said, "Yeah, great." And that was it, really. Went from there. And that was a long, long time ago. So I'm not quite sure what I do, but everybody keeps telling me I'm quite good at this.
Yes,
Hello,
Juliet.
by the way. It's good to see you.
Yeah, you know, John is a very humble man. He doesn't like to brag about his position. He's a managing director, and he sees to the affair of the operations of the staff and the communication within the team. He is actually also a board of the director as well, and he manages human resources, and they see to the overall operation of the whole company to see its functionality in terms of the services we are putting out and everything else. So it's really really amazing working with John for over a period of more than half a decade. And he has been very consistent with making sure that people out there are going to get the best when it comes to health and wellness.
That's brilliant. And of course, Jeanette, we haven't heard your voice. If you can tell us what is your role within the team, a wonderful, wonderful team.
Good evening, everyone. I just got the invitation about
Good
like
evening.
5 minutes ago, so so I missed most of it, which is a pity. But anyway, hi everyone. I could
Hi.
give you a whole story, but I'm very good at bringing joy into people's lives. And I just found out recently that joy is one of the highest frequencies for health, which I suppose I'm on the right track. And
Yes.
I like to connect people to the right products. I tend to attract very, very cutting edge products and services. In fact, in a few weeks, I've got a workshop here in the Netherlands. I'm in the Netherlands, and I'm bringing 4 healers over from one from Ireland. He actually, have you ever heard of synesthesia?
Tell us what it
He,
is.
very interesting. 4% of the population have a gift of seeing colors, like literally your aura. And this is a man that's coming over who can actually see all the colors around you. And he repressed it for years because he didn't want to be different. He'll be here. I've got a wonderful man who's joined, actually, as far as I know, he's joined the School of BioNatural Medicine, Gordon Hughes. He makes his own sacred geometry, beautiful, beautiful products. And I have another healer coming who actually sells the most beautiful water filters. He's been a healer all his life as well. And then the fourth one is somebody you probably all know. His name is Michael Franklin. He's coming over as well. Isn't that cool? And
Okay.
Sonny, you're very welcome to come over too. In fact, all of you are welcome to come and join this life-changing weekend. And then
We will try.
I'm telling you,
We will try.
there's no words to describe what that weekend entails. I see people healing right in front of my eyes. So there you go.
Wow. Wow, 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 wow. Okay, we're going to ask Dr. Sunny. Dr. Sunny, what do you do for the? I know you are the founder. I'm assuming that you oversee every aspect of the business. Oh, he's gone. I think he's having problems. Yeah, he's having problems.
He's gonna
Okay,
come.
so I am so pleased that you all came to this very show, to Matt Moriah Radio and the television as well. It's going to be on YouTube and other social media platforms. And this is something that will run and run for quite in a long time. And coming here, presenting yourself and telling the world what you do will give confidence to people. And they also will be aware of what is happening in the School of Bionatural Medicine. And those that want to join, those that want to also showcase new innovations, wherever they are in the whole world, they will be able to connect with you. What we're going to do here is to send or put the link where people can just click and they can join the program as wherever they are in the whole world. I want to really appreciate you. I want to say thank you so much for coming to my show, gentlemen. And I can only wish you well. I know that we're going to come back in about a year or even 5 years' time, and we're going to say to ourselves, my goodness, look at how far we have come. I'm going to be part of your team. I'm going to join because I am very much into medicine, bio-natural medicines, and how it helps people across the world. So I wish you well. And I know this is not the last that I'm going to have you on my show. We're going to come back again in the next few months and ask you how far, what is going on, what is new, and how can people be part of it. Thank you. And
Thank
thank
you
you
so much,
so,
Juliet.
so
Thank
much.
you. Lovely
Thank
to
you very
meet you.
much,
Thank you.
Juliet.
Thank you very
All
much.
right.
And
Yeah.
Dr. Sonny, even though we can't see you, we just want to say thank you so much for bringing this team together today. God bless you all. Bye
Thank
bye.
you,
Bye-bye.
everybody. Take
And
care.
viewers, thank you so much. Bye bye.
Thank you.
Thank you.
Bye.
Okay. Bye bye.
Mhm.